Joining us today on our edition is Jeremy Curtis, manager of Henry Ford Jackson at Home. Jeremy, welcome to the show.
Thanks for having me.
Great to have you here. And it was just last Friday, the Hit 'em for Hospice golf outing was held at Clark Lake Golf Course. It was a beautiful day.
Beautiful day. Great to support our hospice home here in town. All the proceeds go to support that and the care that is needed for those patients in the hospice setting.
And that's an area that's part of all of your domain at Henry Ford Jackson at Home.
Yeah, to clarify, I manage the palliative care part of it, but it's a large department that includes home health care, palliative care, hospice, and our freestanding home medical supply. Yeah.
Awesome. So tell us a little bit about yourself and how your role at Henry Ford Jackson connects with the community.
Yeah, I'm a nurse practitioner by training. I've been an NP for 20 years around this community. Officially, I've worked for Henry Ford for the last 4 years, and as said, I now manage the palliative care program, also known as advanced illness management. We have two arms of that, one where we have an inpatient team that sees patients in crisis, and then we have a community team that goes out to patient homes and sees patients that have chronic illnesses, life-limiting illnesses, and we really just try to optimize their care in partnership with their primary care physicians or specialists to improve outcomes and give them better quality of life.
In addition to being the manager, are you also a provider?
I still do some patient care. My managerial responsibilities do take me away from that, but I see patients about once a month still. Yeah.
Awesome. So advanced care planning, we were talking about this a little bit before the show. How does your work connect to advanced care planning in the community?
Yeah, so when you hear the words advanced care planning or advanced directives or power of attorney, those are all scary words for a lot of people. Yeah. And what we do in palliative care, beyond just that optimizing a patient's symptoms if they're going through crisis, we do a lot of goals of care discussion. What are their beliefs? How do they want the rest of their life to look if they are have a chronic illness? Do they want to go back to the hospital? Do they want CPR if there was a catastrophic event? So advanced care planning is really having those in-depth conversations with a patient and their family or loved ones to outline what they want.
Yeah, as you say, it's something no one wants to talk about.
Right.
So how do you recommend people get the conversation going so that it's it's comfortable and productive?
Yeah, it's a heavy topic. No one wants to think about end of life or that immortality or the what if. But there's a lot of resources. We have a lot of great primary care physicians in town and specialists. They are all well versed to have these conversations. But if you're at the hospital, their nurses are great at it too. But our service really have had a lot of training on how to have these conversations. And in fact, we'll talk about it in a minute, but we're having a workshop where it's going to be families can come in non-crisis experience where we can have these conversations and conversation starters. But I always say, around, maybe not on Thanksgiving, but when you're with family, you may want to have that conversation of, what if happens? I don't want this or I want this, and that way it's known.
Yeah, people say, oh, if it happens to me, pull the plug.
Yeah.
I don't want an open casket, things like that.
Right.
So there is, when you go to the hospital or go to see a provider, they'll ask, do you have an advance directive?
Right.
Is that basically a form? Is it something you can fill out?
It is. It is. And there's a lot of terms out there that are similar, and there's a lot of confusion about that. Living will, advance directive, power of attorney. An advance directive really does outline what your goals, your beliefs are, so that if you can't speak for yourself, your family, loved ones can respect your wishes at those really difficult times. Mm-hmm. In the hospital setting, a lot of our providers are brought in because there isn't an advance directive and the patient can't speak for themselves. So a lot of family meetings of, what would grandpa want in the situation? So having that paper, that document ahead of time really takes a lot of the stress off the family, so we're respecting somebody's wishes.
What would you say are some of the common misconceptions or barriers when it comes to completing these documents?
There's a lot, and there's a lot of myths out there about it. Again, this is a document that really outlines what you would like done in a medical setting. There are financial power of attorney forms. This has nothing to do with finances. That is, I would go seek an attorney's evaluation for that. But the two forms that we really look for is an advance directive. What are your goals and wishes? And then if you can't make a decision for yourself, who is your medical power of attorney? Because if that is not designated and there's a large family, it can get a little sticky.
Mm-hmm. Yeah, so someone's boyfriend, they're not married, and suddenly there's no connection.
Right. Or if there's not next of kin, or if there is next of kin, but they're estranged, it really can get really sticky pretty quickly when you can't speak for yourself.
And I would imagine it takes the burden off someone having to make a decision, especially in that stressful time.
Yeah, so you're in the hospital, you're already grieving or in stress mode, and then having to make these big decisions can be very overwhelming. There's a lot of guilt that people express to us when we're having these conversations. So again, in a non-critical setting, stress-free environment, to really sit down with your family and talk about it is really important.
Yeah, and it's words like "do not resuscitate."
Yes.
All right. So you mentioned the workshop. That's coming up.
November 5th from 9 to 4. We are having a drop-in workshop for the community. It's open to anybody in the community. Most people will say, I only need an advance directive if I'm sick. I think the best time to have it is when you're well. That way you can, that's one less thing on your plate. So 18 and up, it's free of charge, it's drop-in. My team will have educational sessions to go further in depth on these documents, and then we will actually help you complete the documents right there.
Oh, so it's one and done.
It could be, yeah.
Should you have your spouse with you? I mean, if it's I can imagine that people fill out these forms, and then when it comes time, other people don't know.
Yeah, there are some requirements, signatures, witness signatures that have to happen. So I definitely think if you are going to designate a power of attorney to make decisions, medically decisions for you, bring that person with you so we can authenticate that person will accept that responsibility.
Right, because that happens.
Yeah,
it's
absolutely.
like someone, they chose you as executor of the will, and you don't know it.
Yeah, and just to clarify, because you said executive or will, this is not will, not estate planning at all. Yeah.
No, it's not power of attorney. It's power of
medical decision making.
Medical decision making. What would you say the percentage of people that have advance directive?
I don't have a number for you, but just anecdotally, it's very small.
Very small.
Yeah.
So you hope that people would have, by going to the workshop, that they would come to a point where they get the advance directive.
Yeah, and again, it's drop in, come in for just education. We can give you the forms to take home, to have the conversations. We can help you complete them. Because these are big decisions, and they mean a lot. So it's a very open atmosphere. All of our providers in town have these forms at their office. If you trust your primary care physician, that'd be a great person to have the conversation with too.
And you can, if you make an advance directive, 5 years down the road, you change your mind about something?
You can always change your mind.
Okay.
Now, if you change your mind, I would get that document adjusted. But yes, you can always change your mind.
He changed his mind. He wrote it all. It's all right here. It's in pencil.
Absolutely.
Okay. So what would you say to community members who are hesitant to attend or to start the process?
Yeah. I think we've talked a lot about it. Yes, you can change your mind. You can change the document at any time. And I think there's hesitancy for community members because these are heavy topics and people don't want to talk about these topics. So I think that's the big hesitancy. And then just the confusion around what does this document mean? Oh my gosh, I'm signing something here and it's forever. So we'll go into more in depth on this workshop.
Nice. And involve your family members, right?
Absolutely. Yes. The more people know your wishes, the better off you'll be.
Right. And there are, besides the medical decisions, there's a lot of other things, the end of life, financial and funeral arrangements and all that.
Right.
People should think about that at the same time.
Absolutely. I think the more that you're prepared for all of that end of life stuff, your financial planning, estate planning, again, that's not what we're going to do, and I would seek an attorney for that, but all of that really takes the pressure off of your family at the time of death.
A lot of people, and you probably hear this a lot, oh, I had no idea we had this hospice service or palliative care in Jackson. Is that something people can even plan for, or does it just, it's...
Yeah, and then the difference between the two. So hospice, I mean, I think most people hear hospice, they have a pretty good understanding of what that means. It's end-of-life care, comfort. You've changed your philosophy that you're probably not going to go back to the hospital, and our wonderful hospice nurses at Henry Ford will give you great care in your home or at the hospice house. Palliative care is an extension of that, where patients have a life-limiting chronic illness, but they may be seeking treatment. For example, we partner a lot with the oncology clinics. So a patient undergoing chemotherapy, we may manage a lot of the symptoms in partnership with the oncologist for the nausea that comes with the chemotherapy, or there's a lot of pain sometimes associated with cancer. That is really our specialty of managing those symptoms.
Well, it's great that we have you here and your team, and we appreciate you being part of Wellness Wednesday today.
I appreciate it. Thank you.
Good to see you again.
Good to see you too.
The manager of Henry Ford Jackson at Home, Jeremy Curtis, today on Henry Ford Health Presents Wellness Wednesday.